Colon cancer is the third most common cancer in the world. It affects both men and women, and in many cases, it's deadly because around 50% of colon cancers are diagnosed in late stages. Once it reaches stage 3 or 4, the survival chances drop significantly. But here's the good news. In many cases, colon cancer can be prevented, or at least caught early, when treatment is most effective and survival rates go up dramatically. So in this video, I'll tell you the main risk factors for colon cancer, how it develops, how to detect it early, treatment options, and the realistic prognosis you need to know. Let's begin with how it starts. Genetic mutations play a key role, especially mutations in APC, KRAS, and TP53. These are genes that regulate cell growth and death. Another major cause is chronic inflammation in the gut. Conditions like ulcerative colitis or Crohn's disease lead to long-term inflammation. This damages DNA, and over time, the body's repair systems go into overdrive, increasing the chance of cancer. The third pillar is an unhealthy gut microbiome. Low diversity or too many pro-inflammatory bacteria can directly support tumor growth in the colon. Now let's look at the main risk factors, backed by data. Age, the clearest risk. Around 90% of colon cancer cases occur after age 50. Low fiber and high red or processed meat diet. This increases risk by about 30%. It causes inflammation and promotes polyp formation. Obesity raises the risk by up to 50%. Because it elevates insulin and IGF-1, both stimulate abnormal cell growth. Alcohol and smoking combined increase the risk by around 40%. Inflammatory bowel disease is one of the strongest predictors. It can raise the risk by up to 6 times. Family history also matters, especially if a first-degree relative had colon cancer. A sedentary lifestyle can raise the risk by about 30%, partly due to slower bowel movement and prolonged exposure to toxins. And type 2 diabetes increases the risk by around 40%, due to insulin resistance and low-grade inflammation. These are clear, measurable factors. And by addressing them, we can significantly reduce the risk. Most colon cancers are diagnosed after age 50. But they usually begin developing much earlier, often as polyps. That's why our main goal is to find and remove those polyps early. Screening is the key, and most guidelines recommend starting at age 45. If someone has strong risk factors like inflammatory bowel disease or family history, screening should begin as early as 40. Screening means detecting polyps before they turn into cancer. Colonoscopy is the gold standard. It's done every 10 years after age 45 and can detect and remove polyps in the same procedure. Fecal immunochemical test, FIT, is done once a year. It checks for hidden blood in the stool, an early cancer sign. CT colonography, or virtual colonoscopy, is less invasive, done every 5 years. But if it finds anything, a regular colonoscopy is still needed. Sigmoidoscopy is done every 5 to 10 years. But it only looks at the lower part of the colon. Colonoscopy is still the best. It checks the entire colon and has a sensitivity of about 95%. It misses only around 4% of cancers and can detect large polyps in 99% of cases, and even small ones, under 5 mm, in about 80% of cases. Very rarely, some flat or hidden cancers can be missed, especially in early stages or if they hide behind folds. But this is uncommon. Now the good news, colon cancer is treatable in many cases. In stage 1 and stage 2, the cure rate is high. Even in stage 3, when cancer spreads to lymph nodes. With chemotherapy, the cure rate can reach 50 to 60%. But in stage 4, the cancer spreads to distant organs, and a cure becomes rare. Still, with modern treatments, life can be extended and symptoms controlled. Recurrence depends on the stage. Stage 1, less than 10%. Stage 2, around 10 to 20%. Stage 3, up to 50%. This is why prevention matters so much. Now I'll tell you the top 9 steps you can take to prevent colon cancer. Let's start. Step 1. Get a colonoscopy after age 45 and repeat it every 10 years. This alone can reduce death risk by up to 70%. Step 2. Eat enough soluble fiber. Beans, almonds, flax seeds all contain it. This fiber ferments in the colon, forming short-chain fatty acids, which protect the colon lining. Insoluble fiber is also essential, found in whole grains, wheat bread, and bran. It speeds up digestion and reduces how long toxins touch the colon lining, cutting cancer risk by up to 30%. Constipation isn't a direct cause, but chronic constipation may increase the time harmful substances stay in the colon, which might raise long-term cancer risk. Probiotics help too. The most studied strains are Lactobacillus rhamnosus, Bifidobacterium longum, and Lactobacillus casei. They help balance the gut microbiome, reduce inflammation, and support the intestinal wall. Yogurts are a good source, especially those with added cultures like rhamnosus. Always check the label. Kefir, some cheeses, and fermented foods like kimchi or miso also help, though they don't always contain specific strains. Sometimes, it's better to take probiotic supplements. For example, rhamnosus at 1 to 10 billion CFUs per day. A dosage shown effective in most studies. Exercise matters too. More than 150 minutes per week can reduce colon cancer risk by about 30%. Stop smoking. Limit alcohol to less than 1 drink per day. Manage type 2 diabetes. And make sure your vitamin D levels are healthy. If they're low, correcting them can reduce risk by around 20%. We cannot control every gene, but we can control our habits. We cannot predict every mutation, but we can stay one step ahead through screening, movement, and food. We cannot eliminate every risk, but we can give ourselves the best fighting chance by choosing prevention over reaction and awareness over regret.